Every 40 seconds, someone in the world suffers a heart attack, and in most cases, the warning signs were there, but they were silent. Inside your body, arteries carry oxygen-rich blood, like highways of life. But when these highways become 70% blocked, the danger zone begins. And the most terrifying part? You may feel almost nothing. Tonight, we reveal the 7 silent signs your arteries may already be 70% blocked, backed by science, cardiology, and real clinical patterns. When plaque, made of cholesterol, calcium, and inflammatory cells, builds up inside your arteries, the condition is called atherosclerosis. At 70% blockage, blood flow becomes critically reduced. The heart muscle begins to suffer oxygen deprivation. Risk of clot formation dramatically increases. This stage is often called the ticking clock phase by cardiologists. Now let's uncover the signs your body may already be sending. Not severe pain, not crushing pressure, just a subtle tightness when walking upstairs, or mild heaviness after a short walk. This is often angina, reduced blood supply to the heart muscle. At 70% blockage, angina may only appear during exertion. When you rest, it disappears. That temporary relief fools millions. When arteries narrow, the heart struggles to pump efficiently. You may notice breathlessness while talking, feeling winded climbing stairs, needing frequent pauses. This may indicate early coronary artery disease. Many mistake it for aging or low fitness. Persistent fatigue, especially in women, is one of the most overlooked cardiac warning signs. When oxygen supply drops, your heart works harder. Your body feels drained. Studies show fatigue can precede heart attacks by weeks. Blocked arteries don't always scream through chest pain. They whisper through left arm discomfort, jaw pressure, upper back ache. This is called referred pain. Nerves from the heart share pathways with other body areas. Never ignore unexplained upper body discomfort. Reduced blood flow irritates heart tissue. This may trigger arrhythmia, abnormal heart rhythms. You might feel skipped beats, fluttering, racing pulse. Not all arrhythmias are dangerous, but combined with blockage, it's a red flag. When the heart is under stress, your nervous system activates. This can cause cold, clammy sweat, mild nausea, sudden anxiety. These symptoms often appear before major cardiac events. Persistent hypertension may signal stiff, narrowed arteries. When vessels lose flexibility, pressure rises, heart strain increases, blockage progression accelerates. Hypertension is both a cause and a consequence of arterial narrowing. Cardiologists consider 70% blockage the tipping point. At this level, blood supply becomes critically compromised. Small clots can fully block the artery. Risk of heart attack rises sharply. A simple plaque rupture can lead to a full obstruction within minutes. Blocked arteries don't always roar. Sometimes they whisper. If you experience even 2 of these signs, especially with risk factors like diabetes, smoking, obesity, or family history, consult a cardiologist. Tests that detect blockage include stress testing, CT, coronary angiography, traditional angiogram. Because prevention is powerful, your arteries may be silent, but your awareness should not be. Your heart beats nearly 100,000 times a day. Make sure it never beats for help.